Hi, good morning, everybody. Thanks for being here today. I'm Chris Tompkins. Joe, you introduce yourself?
Good morning, I'm Joe Russo.
Really appreciate the opportunity to go into these things. For me, as a technical standards expert, anybody use the word SCORM day to day in their job? Okay, cool. That's my side of the house. I love interoperability, getting tools to play nicely with one another. But the far more interesting part of this discussion today is Joe is actually using some of these technologies in really interesting and innovative ways. So today I'm going to guide us through these things, but Joe is mostly here to talk about what his organization is doing to help manage a learning ecosystem inside of a healthcare situation, which is not as simple as it seemed to me at the beginning, and I learned a lot through Joe. So you mind walking us through a little bit? I know it's important to distinguish between the university and the medicine school. Joe,
Right.
take it away.
Yeah, so I work for Penn Medicine. Penn Medicine is made up of three basic entities: the University of Pennsylvania, the University of Pennsylvania Health System, that's where most of my work is, and then our Perelman School of Medicine. And if you don't know, Penn Medicine itself, when you hear the term Penn Medicine, it is the health system plus the School of Medicine. So we are an academic medical center, which means that we not only have hospitals and patients and all of that, but we also do a lot of research, and we're a teaching facility. And so we partnered with Content Controller because back in 2022, the University of Pennsylvania and the School of Medicine decided that they were going to move to a different learning management system. We used to share one learning management system, and they decided to move to another one, so we needed a way to share content. I actually work in Penn Medicine Academy, so Penn Medicine Academy creates and tracks different training ranging from leadership development, career planning, change management, as well as learning solutions and learning management, which is my area. So we needed to easily distribute content to our learners, and we wanted to ensure that employees both at the university, the School of Medicine, and of course within the health system were able to access that content easily. The fact that they moved to a different LMS meant that there are some people in the School of Medicine that work, for example, faculty work as physicians in the health system. So there are health system requirements that require them to get onto our learning system. And then there's requirements in the university and the School of Medicine that requires that they get on that learning system. So we wanted to be able to make sure that we were able to share content across those LMSs. So one of the beautiful things about Content Controller is, besides being able to share the content, is that it made it so much easier for us to upload content, to version content. Things that would take us at least an hour were things that we could complete in less than a minute with Content Controller. So this is just an example. You've all probably done this before. You have new content that you need to upload, or you have a new version of the same content that you need to upload. So before, we had to make our changes. We had to download the course from, we use Articulate 360, so we'd download that course, send a zip file. Imagine, if you will, now that we have two LMSs, we would have to send a zip file over to the university. We would have our own zip file. We would upload that into the LMS. Then we'd have to do all of our testing and, of course, all of that. The beauty with the Content Controller is that afterwards we're able to immediately just upload that content into Content Controller, do all of our testing there, making sure that it works. And then in a few clicks, once we've tested it, in a few clicks we can publish that content, and it's available in both LMSs at the same time.
So Content Controller is a tool that helps a lot of folks just like Joe through many different verticals. Healthcare is a great use case where there's not one LMS to rule them all. And while 26 years ago, when the e-learning industry was first getting into these things, we always thought a learner's journey would be in one system. and beginning, middle, end, all the way through, we would be able to see a learner's progress. But as corporations grow, as healthcare systems grow, there's often 3 or 4 LMSs and 25 to 30 pieces of learning technology at any one organization. And that's okay. The one LMS to rule them all prospect just isn't true in 2025. And instead of fighting against it, everyone says, I hate my LMS, and I don't know why that is always true, but it's a consistent thing. And to Joe's point on the previous slide, when you have to update things in multiple LMSs, every LMS administrator I've ever met in my time doing this has 47 other jobs. And getting their attention and getting them to take the time to take down your file and put a new one is really difficult. So technologies like Content Controller help content teams, folks who know how to train people on what to do and how to do it, efficiently deploy to where that learner lives, make sure that the reports and check marks are where they need to be, but then help the people who are actually building courses study what's going on, track completions, grow things the way they want, and more importantly, mix and match. There are instructional designers in this room who should pick one type of content over another, whether it's a video, a SCORM file, modern CMI5, it doesn't really matter to the LMS. And so Joe's team is able to mix and match both the type of content that they're putting into Content Controller and the tools that efficiently connect them out to another LMS without having to worry about versions of SCORM and what you're doing. Do you want to talk a little more about that?
Yeah, and to your point, we're our administrators are all over the health system. So and like you said, that is not their main job. So their main job might be a nurse manager or an administrator that is not really focused on the LMS itself or even focused on instructional design. So we have administrators all over that are creating content that want to get it up into the LMS quickly. And that content can take many forms. So like I mentioned Articulate 360, we also use Rise. And so we have different administrators that create different content. We have some that use Captivate, so it's kind of all over the place. And then, so one of the things that, if you want to go to the next slide, one of the things that was really exciting for us and that we've started to work with is MP4s. So with MP4s, we can create video. And in the past, we've had to create that video, but then sort of put it into Storyline and encapsulate it into a format that we could then upload to the LMS. But with Content Controller, we don't need to do that. We can upload that video directly to Content Controller, and then the dispatch file that we get from Content Controller, we put it in the LMS, and that manages the completion. So we've started to create QR codes for different equipment training. We can put those QR codes on the equipment. A nurse could walk up, scan that QR code, it takes them into our LMS and they watch the video, and then once they're done with watching the video, they get that completion credit right away. So it really cuts through all of the work needed to encapsulate it in Storyline and upload it and test it and everything. It's really made things much easier for us.
So go where your learners live. Instead of constantly fighting a battle of, oh, I need my own learning system and you've got to come in here, Content Controller helps you jump to delivering it directly to them in whatever format works for your content creation team, but also integrating with an LMS in the case that you need a completion. There is a compliance requirement. There's a lot of reasons why you have to go to a certain place to give them a play button. And with Content Controller, Joe's team gets a lot of flexibility to just go where those learners are and not really care about that system at all.
Yeah. And another thing is like I'm a technology person, so I love to like really get into the technology. But like I said, our administrators out there, that's not their main job. I can, when I talk about technology to them, their eyes kind of glass over. So we want to make it as simple as possible for them. One of the things that we really wanted to simplify was versioning. So in our LMS, we use SAP SuccessFactors LMS, by the way. I'm not sure if anybody else does here, but when it comes to versioning in that LMS, it's not the easiest or more straightforward process. However, with Content Controller, we can version content very easily, like I said before, just in a few clicks. For example, when we have a course, we need to update it. We can upload that file immediately into Content Controller. Like I said before, we can test it, and then in a few clicks, publish that to the LMS. The dispatch file, I don't know if you're familiar with dispatch files in Content Controller, but you're basically downloading a dispatch file, and that's the file that goes in the LMS. That file itself doesn't ever need to change. You're uploading your content to Content Controller, testing it, clicking publish, and then once you click publish, it's available immediately in the LMS. So it really reduces the amount of time that it takes to, or that it did take for us to do all of that in the LMS itself.
So to expand a little on what Joe said, when he said it doesn't matter what file I put in the LMS, they're typically 10 kilobyte SCORM files. If any of you guys are using an open source LMS like Moodle, Moodle only takes SCORM 1.2, but you might have advanced content for reasons. And we drop a 10 kilobyte SCORM 1.2 file in that LMS, and then the content team can update it daily. They can run reports to see who took what, when, where, how, why. And more importantly, Joe's team can start to notice that no one ever answered question 3 correctly. Why is that? Did Chris mark the wrong answer as correct, or did we not teach that thing properly? And being able to intervene at learner 30 instead of learner 30,000 has a real cost savings built into it with retraining, reskilling, especially in a high compliance or regulated environment. So This little trick is simple, but it also removes a lot of burden from those LMS administrators with 47 other jobs, because now they don't ever have to touch versioning. You get it loaded in, you get it assigned to the right learner, and then you let the content team deal with delivering the content.
Right. And so, like Chris said, of course, we're a health system. We're very highly regulated, so we do have to answer to different regulatory agencies. And so if there's a question about, hey, what content did this person take? I see they completed it on March 1st, 2025. What content, what version was in the system at that time? Content Controller allows us to get to that kind of detail very quickly. So we can see reports of individual learners, what content they took, what version of that content they took, on which date. So we can get as in-depth as we want. Of course, like 90% of the time, our reports in our LMS itself are fine. But when we get those regulatory questions, we do have the ability to go in and export that information.
So I hear it over and over. Content teams annually go to their LMS admin and say, hey, can you run a report? I want to see how effective my training was. And they're like, yo, I'm busy. Go away, right? So with Content Controller, you can see in almost near real time. If you're using advanced standards like SCORM 2004, 4th edition, we can even get into individual questions and answers and whether they're right or wrong, even if the LMS can't report on those things. And often LMS administrators just need the completion, but the content team wants to improve their craft. And so this is a great bridge to give you the data you want without having to work with a team that's not a part of your sphere of influence, if that makes sense.
So one of the other things that came up when the university and School of Medicine decided to move to another LMS is the health system had to reflect on the LMS that we are using and whether we wanted to change as well. So we haven't so far, but there's always that talk in the background about, are we going to move to a different LMS? And if you're familiar with SAP SuccessFactors at all, the built-in content management is not that easy to use or to transfer to another LMS. So one of the beautiful things that we saw with Rustici and Content Controller is that we would have full control of all of our content, the organization of the content, and Rustici also allows us to do batch uploads of content and batch downloads of content. So those dispatch files I was talking about, we can download those dispatch files in batch, upload, and then whatever LMS that we move to, if we decide to move to a new LMS, we can upload those directly into that LMS. And we don't have to move content. We don't have to worry about getting our content from SAP, reformatting it for the new LMS and then uploading it. With Content Controller, it's just an easy transfer of just those dispatch files to a new LMS.
So again, if you look at the diagram on the right, those little tiny dispatch files are what you work with the LMS administrator to make them happy. Oh, I only know how to use LTI. Great, we'll do that too. We can put whatever content we want in, and there are reasons why instructional designers, content creators should be picking one of those standards, but being able to just efficiently give whatever LMS administrator asks for is a super move. We also see a lot of situations, especially in healthcare, where, there are these 15 learners that are contractors and they have their own LMS, and how are we going to get in there, give them whatever they ask for? It makes it super easy. It saves a lot of security reviews. You don't have to have a technology council. Imagine how your content's going to fit in their world. You give them what they ask for, they say thank you, and then you get to see what's going on and version it to match the mission. It's really slick.
Right, so the results that we've had, we have over 60,000 learners in our LMS, and we've, like I said before, it made the content management, the reporting, testing, and everything so much easier for us. And we are able to provide a seamless learning experience and I mentioned before, those about 4,000 faculty and physicians that have to access content in 2 different LMSs. We've made it so much easier for them to be able to access that. We can tell which LMS they accessed it from, directly from Content Controller. And so it's really seamless to them, and that was the important thing. We didn't want to have to explain to a physician, well, if you need to do this content, you need to go here, and all of that. So it's seamless for everyone. And of course, we created a better user experience. And a big positive that we didn't really expect from this is that it has reduced our support requests. So we used to get, when we're uploading content directly to the LMS, we would get support requests. I didn't get completion, or this content isn't working properly. And so we would have to go through hoops to test the content again, figure out what was happening, and so forth. But with Content Controller, we were able to do all that testing right in Content Controller before we even publish it in the LMS. And we have actually seen a reduction in our support tickets. I think that's on the next slide, yeah. So in 2022, that's when the University and the School of Medicine decided to move over. We implemented Content Controller in our system first quarter of 23, and we saw a huge decrease in the number of support tickets for people contacting us for either completion problems or the course didn't launch. So it's been terrific for us. We've seen all of those support tickets go away.
And that's a really powerful moment in a room where L&D is always trying to provide value and show the justification for the tools that they're buying and the strategies that they're using to cut out lost completions. It saves real human time. It saves a lot of frustration. And in a highly regulated environment, it's a super move. So this is really exciting for somebody who builds tools to say, oh, that was always the plan, and here it is working.
Yeah, and we don't want our physicians, our nurses to be focusing on, oh, well, why didn't I get completion? Why won't this course launch? We just want it to work right out of the box, and Content Controller gave that to us.
Content Controller should help reduce your lost completions to below 1%. Sometimes there's a problem between the keyboard and the chair that people sit in. You're never going to get to 0, but if you are running into that headache a lot, tools like this can drastically solve those problems.
Yeah. And so just to give you an idea of our utilization, so our SuccessFactors LMS, at last count, we had something like 3,000 courses in the LMS and over 1 million completions. With Content Controller, we've now put 300 courses in Content Controller, but those 300 courses account for over 500,000 completions. So just 10% of the content that we moved to Content Controller accounts for almost or over half of our learning completions. So we're really focusing on the courses that are used the most. We have, of course, courses that go out to everybody, like HIPAA training, infection prevention training, and all of that. So we want to focus on those courses that people use the most, that are, typically the sources of those support tickets. And we're adding 40 more courses by June. That's our goal. And just those 40 courses is going to increase our utilization based on number of completions to over 70%.
Nice. So we've covered a lot of ground today, and I'm eternally grateful to Joe. It's one thing to build a piece of software and imagine how people use it. It's a complete other thing to say, hey, this changed the world for this team and these guys. So thank you, Joe. I really appreciate it.
Absolutely.
We are going to hang out for a few minutes. If anyone has specific questions about how this happens, the outcomes that Joe's seeing, you've got a weird situation you want to talk about, I love this stuff. I help e-learning technologies work together every day, all the time. But Joe having real-world experience using these tools is far more valuable than talking to me about SCORM. So thank you all for being here. We really, really appreciate the time. And please come check us out. Talk to Joe. We've got a stand in the corner. I'm always happy to help solve these problems. You can ask us anything, really. And big round of applause for Joe. I talk all the time. I really appreciate you being here. Yeah. Thanks, everybody.